Well, good afternoon, everyone. My name is Beck Pajo, and I am the Executive Director of United and Homelessness with Orange County United Way. And I am thrilled to welcome you to one of a three-part series during our Hunger and Homelessness Awareness Week campaign. Today is day one for a series that we are looking at the crossovers between mental health and homelessness. And I'm really excited to be joined by a panel of experts who are going to share with us their insights, their knowledge, their expertise as we begin our three-part series. Hunger and Homelessness Awareness Week is a culmination of over 20 different local organizations working together to bring in-person events, virtual events like this one, a social media press kit to life to make available for anybody who wants to be involved in the campaign. You can be involved by using the social media assets. They're available on our website for you. Feel free to grab those, use those. That's what we make them for. And thank you for being a part of it by tuning in today. And please feel free to join us at any upcoming events that we have. I'll talk more about that at the end of the program. But I really am grateful for the opportunity to dig into this conversation. And we recognize that topics like the one that we're going to talk about today could affect us personally. And so that's why we wanted to be mindful of providing the resource of the number 988 at the start of this program. And we'll make sure that we pop that information into the chat box. And again, at the end of the program, if you or anybody else is in need of access to mental health resources. So with that said, I'm going to introduce our experts today. I am delighted to be joined by Dr. Cameron Carter, Distinguished Professor and Chair of the Department of Psychiatry and Human Behavior at the UCI School of Medicine. I'm also delighted to be joined by Kevin von Luft, the Director of Mobile Operations at Be Well, and Parisa Mehrinfar, the Regional Clinical Supervisor for the Mental Health Association of Orange County. So thank you to each of you for joining us. And I'd encourage you at this moment, let's turn our cameras on. And I'm going to ask you for our very first question. How did you get into this field and what is it that inspires you? And Parisa, I'll come to you first.
Hello, first of all, thank you for having me. I'm very excited to be here. Great question. What introduced me to this field? I feel like I just always had a strong interest in the field of psychology. I loved reading it for fun and leisure. And then I did my internship when I was an undergrad at UCI at Fairview Developmental Center, which was a big institution, and it really opened my eyes to all these government-funded projects where we would institutionalize people. But the way it worked back then, I feel like a lot of the members I spoke with, they were feeling dismissed and they wanted to be back part of an integral part of society, and they weren't really focusing on skill building there. So, it made me really think, all the social workers here, psychiatrists, it takes a multidisciplinary team to get these folks back on their feet. So I love it. I fell in love with it since day one, and I haven't looked back since.
Wonderful. Thank you so much. Kevin, how about you? What's a little bit of your story?
Sure. Again, thank you for having us on this. This is great. So I actually recently retired after 25 years at the Irvine Police Department as a police officer. And for the last almost 8 years, I was involved full-time in their mental health outreach program. And a couple of years prior to that, I had got a master's in clinical psychology. And I really, if you look at that progression over the last 10 years, is really about seeing firsthand what was happening in communities and streets about mental health and homelessness, and really having a desire to want to help law enforcement do something different than we were already doing. So I helped upwrite at that time, our mental health outreach program, which was a little bit of a paradigm shift for a law enforcement agency to actually start doing more social work, even though we all inherently at the time felt that officers weren't the most appropriate professionals to be doing it. That's all we had. Right, that's the resource that we are available to us. So how do we think outside the box and do something different with a proactive outreach model? So that kind of led me through that, and then 25 years kind of came around, and I said, oh, that's good enough. And you know, kind of engaged with Be Well and got involved and came on as the director of mobile operations and helping our teams out there respond to these calls on a daily basis involving, you know, non-violent, non-criminal response to mental health and homelessness in our communities.
Wow, what a journey you've been on. We've got lots to talk about. And Dr. Carter, how about you?
Yeah, well, first of all, again, thank you for including me in this very important conversation. I early in my life had experienced the suffering that mental health problems can bring through the experiences of some close family members. I definitely that helped to shape my views on the importance of mental health. As a little child, a little boy, I was the kid at kindergarten who walked around with a plastic stethoscope in the little black bag. A little bit like Parisa, I was drawn to medicine at an early time. I can't really remember ever not being convinced that I wanted to be a physician when I grew up. As a teenager, I discovered psychology and was very deeply interested and inspired by the science and the introspection that is at the core of psychology. And then in university, I discovered neuroscience. And I think the juxtaposition of medicine, psychology, and neuroscience meant that I really never had any choice but to go into psychiatry. And I have been practicing psychiatry now for almost 40 years. And what inspires me is people who live with mental health problems, who have resilience and have a unique perspective on life that I think is uniquely healthy in many ways. So that's what inspires me.
Is wonderful. Thank you so much for giving us that little insight into your background and your story. So this is the start of our series looking at mental health and homelessness. And so I would just love to hear from each of you. How would you define mental health? So Dr. Carter, I will come right back to you to start there.
Sure. It's an interesting question. I don't think there's a right answer to this. I think for me, it's the ability to have goals and to pursue them, the ability to have meaningful relationships and to maintain them, the ability to experience the full range of human emotions, and yet not to be derailed by extreme states, uncontrollable thoughts, uncontrollable behavior. I think it's that balance there that defines mental health.
Thank you. Evan, how about you?
You know, for me personally, I see this as just a spectrum of a person, right? So, and on that spectrum, as you operate on that spectrum as a person, you also have seasons of life, right? So as you go through these seasons of life and the spectrum of dealing with difficult things in your life to not dealing with difficult things in your life, all contribute to this concept of mental health, things that happen to you, things that you're genetically born with, all of this in this pie chart of who you are, right? So things evolve and change over time, in my opinion, and what I've seen over the years working with people. And mental health really is about how does it impact your daily life? How does it impact the people around you? How's it impacting your relationships? And that could be on a minor level, right? And some people are able to navigate that and some people aren't. And that can be on a more severe level where, you know, you can't get out of bed because of deep depression, or you are having thoughts of hurting yourself, right? So it's this spectrum, and where you lie or where you end up on this spectrum really determines, in my opinion, what path you take to help you either recover, work through, work past, or reconcile for yourself difficult circumstances or things that have happened to you. And then how you do that, you know, with the help of professional medication, you know, is different for everybody. But I really see it as these daily, we wake up on a daily basis and say, what's in front of me? Am I able to navigate it on my own? If not, what assistance do I need to navigate it? And then being willing to ask for that help. And unfortunately, some people, especially those unsheltered in our communities, are not able to recognize that they need to ask for help. So that's my kind of quick 2-minute definition of how I see it and how I've dealt with it over the years.
That's really helpful. Thank you, Kevin. Parisa, what would you add to this?
Just to piggyback, I would say, right, mental health, for me, I've always viewed it as a state of well-being that's far more than the absence of a mental health disorder. I agree with Dr. Carter, where it instills our decision-making skills, our ability to foster healthy relationships. And then I think we're all on the same page that it's not just individual to individual, it's more on a macro level, collectively, the way we can contribute to society and, build a community and shape the world. So it's very impactful, yes.
Well, it was a beautiful lead up into my next question, which is around the trends that we're seeing in the mental health field kind of across the country. We've had some really interesting times over the last few years, and I'd be really curious, Dr. Carter, to hear your insights on what are some of the national trends that we're seeing.
Well, the trends are not good. I think nationally, there is overall an increase in mental health disorders and addiction, and that cuts across the lifespan. And so perhaps one of the most alarming of the trends is the increase in mental health concerns that young people, children and adolescents have. And we know that the roots of many adult mental health problems lie in childhood and adolescence, but when a person begins to actually have trouble functioning because of anxiety and depression in their teen years, that puts them in a very difficult position going further through life. So I think nationally, when you talk about the prevalence and the intensity and the disability that's associated with mental health problems and addiction, the trend is really in the wrong direction. It certainly was punctuated by the pandemic, but those trends have been happening for 20, 30, 40 years. I think there's a flip side to that, which is that we've made a tremendous amount of progress in terms of our ability to help people with mental health disorders, and even to be engaged in prevention for people at risk for mental health disorders. We have new therapies, new understanding of optimal systems of care, new medication, new ways of helping to support a healthy brain. The challenge is that perhaps the majority of people who have mental health problems don't ever get access to those things that we have, those improved tools that we have to offer people. So it's a big challenge. Things have gotten worse. It sounds doomy and gloomy, but it's real. There's a real crisis. I think we're well aware of the crisis. I think society is well aware of the crisis. There's less stigma and less resistance to seeking help, but it's really hard to get help. Very difficult.
Thank you so much. It's conversations like this one today are really important conversations to be having to help continue to reduce that stigma. But as you say, it really is sad that we are seeing this uptick across the country. Kevin, I'd be curious, how do you see that sort of translating here in Orange County?
Well, like Dr. Carter said, I think you are seeing, this increase in, I hate to use the word gross numbers, but just this macro level increase of people suffering from chronic and severe mental health at all levels, not just unhoused. I know we're kind of focusing on homeless right now in the conversation, but I think it's good to mention that, our teams and response teams from Orange County Healthcare are responding to all levels of socioeconomic and housed and unhoused. And people on the street living unhoused can be suffering some of the similar challenges that somebody living in a $20 million home in Orange County can be experiencing. And I think what you're seeing translate is a very difficult path to care, a very challenging and complicated path to care. Although there is this awareness, a lot of funds and a lot of things are being focused on, that capacity of what we can handle as a community for mental health care and mental health crisis. Unfortunately, the systems are kind of in this mode right now of one program being invented to solve the deficiencies of another program. And you're seeing this layered approach to what's happening for care. So how I see that chronic increase of chronic mental health translated is even more difficulties people accessing care and an understanding of how they access care. So that's a big goal of Be Well. It's a big goal of Orange County Healthcare, working with them very closely on, single number crisis lines and how do we simplify this process. So that's one of the big results that I see from my position, is that challenging path for someone to understand for themselves or a family member. Hey, my son is suffering from bipolar and he's having these episodes. How do I get him care? Right? What do I do? So that is, I see some of the most challenging parts of that increase that we're seeing of chronic mental health in our communities and severe mental health. And on that topic, I think, it's a both of awareness that lead to those numbers. We have a better understanding of diagnosis. We have a better understanding what people are experiencing. And my theory always is, well, when with awareness, if you have awareness, the numbers will come, right? So like I say in committee meetings all the time, talking about the number of beds available and crisis stabilization units availability, I said, we could build 200 beds overnight and they would get filled. Does that mean there was a need for 200 beds? Yes and no, right? If we build 400 beds, they will get filled. So that is only one part of that solution of addressing a continuum of care for some people, that just more beds aren't always the answer. But how do we navigate people getting through a continuum of care to get the help they need? So that's the challenge that I see from my perspective right now when it comes to this increase in our communities.
Thank you, Kevin. And Parisa, how about you? What sort of trends are you seeing that have been going on here in Orange County over the last few years?
Yes, well said. Unfortunately, I can concur that there is a gap in the continuum of care, especially with aftercare instructions, especially with people who are homeless or at risk of homelessness, who maybe this is their first time receiving care. Maybe this is, something brand new to them, and they don't have the tools to maintain all the skills. Let's say they went to a crisis stabilization unit and then they got referred to an inpatient program and they got treatment for 2-3 weeks. Once they're discharged, they're back to square one if they don't have those life skills, if they don't have access to medication, if they don't have transportation, if they don't have emotional support, all these other attributes to set them up for success. I've seen so many people go into programs, get discharged from the program, have zero aftercare, and then come back, right? It's like a revolving door back to the same cycle. So it's unfortunate, definitely.
Certainly sounds like we've made some good progress in Orange County, but we have more work in front of us in terms of access to care and having the right levels of care across that sort of complete spectrum that you were all talking about. So now the Be Well and the Mental Health Association of Orange County are really trying to be responsive to the needs of residents here in Orange County. And I would love to learn a little bit more about some of the programs that you have, not necessarily sort of specific to homelessness, but just sort of across the board. What are the kinds of programs that each of you offer?
Who would you like to go first?
Kevin, we'll go with you.
Yeah. That's always difficult part, right? In these Zoom presentations, like who goes first? So if people on the call don't know Be Well OC, definitely go online and look at the website there to kind of learn about what Be Well is doing in partnership with Orange County Healthcare and many other partners in the community. And we have multiple kind of lanes that we're trying to assist with, in the Orange County continuum of care model. With our Orange campus, at our Orange campus, we have a crisis stabilization unit. We have a crisis residential program. We just launched a new provider for our substance abuse and addiction 30, 60, 90-day treatment programs. So Be Well is really trying to fill some of those gaps that do exist in our system through a public and private partnership with all the hospitals in Orange County Healthcare, CalOptima, and really how do we bring those partners together into a wellness campus that is available to everybody in Orange County. So that's our campus programs. We have Irvine campus that just broke ground a couple of weeks ago, and that's going to be at the Great Park in Irvine, and going to be, if you know our Orange campus at all, that's going to be about 3 times as large as our Orange campus. And some first in the county services with perinatal and pregnancy programs for moms in addiction, where families can live together for up to 12 months while family members in addiction treatment. So some really, really needed type of programs through these wonderful partnerships with county healthcare and our hospitals. So that's our campus programs. I'm involved in our mobile response programs, which is really being that other arm to the emergency 911 system when it comes to crisis in our communities. Like I mentioned, I think we all agree that armed police officers aren't the best fit for what should be happening in our communities for responding to mental health crisis. But again, that's all we had, right? So we're trying to fill that gap with our mobile crisis teams, where we have well-trained crisis intervention specialists responding immediately to those calls through the police and fire 911 systems. We operate in 8 contract cities right now in Orange County and respond to approximately 10 to 15 calls per day in each of our cities regarding these type of calls. And I don't have the number on top of my head right now, but it's over 35,000 people served since the beginning of our programs. 85% no response needed with law enforcement, where we're responding alone on an average of 10 to 15-minute response time. So if you look at what we're trying to accomplish there, it's unique and different and new, and it's really cool. So that's kind of a quick view of what Be Well's doing. And we hope to continue to be partners with everybody in the county to kind of help fill these gaps where it's needed.
Really just is remarkable how far Be Well has come. I remember some very early stage meetings that were happening with these incredible stakeholders from all around the community, sort of gathering and ideating and thinking through what it could look like. And to be where we are today and to hear that report is just tremendous. So thank you, Kevin. And I'll just sort of reiterate something that you said earlier about the fact that your services are for people regardless of whether they are housed or unhoused. And so thank you for the work that you're doing. Parisa, I'd love to hear a little bit more about the kinds of programming that you and your colleagues offer.
Definitely. So Mental Health Association of Orange County is a nonprofit. This year is our 65th anniversary. We have a number of outpatient clinics where you can receive mental health counseling, psychiatric services. And we have a wellness center, which is group-based, and it's for folks that are either housed or unhoused, but the goal is you're more stable in your recovery journey. We offer evidence-based practice groups. We offer 12-step program groups, substance use treatment groups, but also life skills groups, coping skills. They have fun party events where we can promote, human interaction. A lot of these people during the pandemic, they weren't interacting with others, they're staying in isolated environments. We promote community integration, employment services where we get these people back on their feet and working in the community. So just various types of services. And then we have our multi-service center, which is our unique program which serves the homeless and veteran population who are homeless due to mental health struggles. So in the multi-service center, we office employment assistance with working with folks for vocational skills, case management to get them linked to behavioral health clinics so they can start addressing their mental health diagnoses and seeking psychiatric services. We have nursing staff that help provide wound care or any nursing consultation that these people may need. We have a dual diagnosis specialist that offers substance use treatment. And then we have a housing specialist that helps link people to Section 8 housing, shelters, transitional living, permanent housing. So lots of ports of entry for services, and it's all at no cost. I'm very proud to be a part of it. We offer a wide range of services.
It is wonderful. Thank you for the comprehensive care and opportunities you're providing to members of our community. It's wonderful to hear about some of the programs, and I know this is just a couple of organizations. There are more organizations out there as well in the community that offer these kinds of things. But earlier we were talking about the challenge to navigate access sometimes to programs. And also we were talking about the tremendous number of people that might perhaps be in need of accessing programs. And so Dr. Carter, I'd love to hear from you. Is there any kind of data or statistics that you're able to share that point to how many people might struggle with mental health concerns or perhaps might have diagnoses? I know that I myself have had my ups and downs with my mental health over the years, and I too have had family members, with diagnoses and struggles. And so I know that this is something that's pretty prevalent, but I'm curious what there might be data-wise that you might be able to illuminate for us.
Sure. I think that there's lots and lots of data that I think make the point that Kevin made, which is that mental health challenges, mental health disorders, however we want to kind of talk about them, are very, very common. They're a part of life. About 20 to 30% of the United States population will have a major depressive episode at some point during their life. A similar percentage of people, maybe 20 or so, will have a substance use disorder at some point during their life. And the other thing we know, which I again mentioned earlier, is that less than half of people who have mental health problems actually get care for their mental health problems through our mental health provider system. So I think that's also something that we need to acknowledge. And Kevin also referred to the serious mental illness population, people with psychosis, schizophrenia, bipolar disorder. Those are less common, but also common enough that everyone knows someone, everyone has a relative with one of those serious mental health diagnoses. And we know that outcomes aren't great. And I think one of the things that both of the other speakers have alluded to is that part of the challenge is that our system of providing mental health care is extremely fragmented. There's a lot of different there's a lot of different approaches, there's a lot of different groups. There's a complex system of county-based care with, every community, making choices about how they approach mental health care. That has advantages, of course, but it has the disadvantage that within a county there might be many different moving parts. And if we're fortunate, and I know that this is part of BWell's mission, and I think it's a very important one, to get all those parts working together, collaborating, I think that is how you improve things, and you will improve the numbers, by doing that. I do think the challenge is that the need is great, very great, and I think what it's going to take is long-term investment. I think that's one of the other challenges in funding programs and sustaining them in the community, that funding often comes in the form of, grants that will be good for 2 or 3 years, and then the idea is somehow you'll figure out how to continue on without the grant. And I think my collaborators at UC Davis and myself just completed an evaluation of the SB 82 crisis programs that were implemented in 15 counties in California. And I think the big challenge there is that a lot of good work was done, but it was very hard for counties to actually figure out, how you would sustain such a program without the additional funding that was provided. And so I think this is all a way of saying that I think collaboration and coordination can make a difference, and that where we stand right now is that the need is great, and that we struggle to meet the need.
Thank you so much. Kevin or Parisa, do you guys have any kind of data that you'd like to share with us today?
I don't have, like I kind of mentioned some numbers already, off the top of my head. It's when you look at the homeless population specifically that I've worked with over the last, decade or so, it's always that question I get asked sometimes is, well, how many people that are homeless are suffering from, chronic mental health issues or substance abuse issues? And, I always have this chicken and egg conversation with them. What came first, right? Did the substance abuse and chronic mental health issues lead to homelessness, or did they become homelessness because of life circumstances then which caused substance abuse and chronic mental health issues to take hold? I always say it's both. It is a chicken or egg conversation. There's no real clear answer on that, but I would say from my time working with people on the streets as an officer, and then my time here running our teams at Be Well, I do see that significant substance abuse and chronic mental health issues are really prevalent in 90+% of the population that our teams are running into. It's rare that I ever ran across somebody that was not suffering from either of those and found themselves unsheltered. If I did, to be quite honest and transparent, it was because they were recently unsheltered, and they got kicked out, lost a job, something happened in life that caused them to become unhoused. And I could see many, many times over a short period of time, their degrade, right? Trying to get them to engage in services, trying to offer some help. And then, right, we get to that 6 months to a year mark, and you would drastically see a shift in their mental health and their ability to deal with it. So in my opinion, people that are chronically unhoused on the street, for the most part, vast majority of them are suffering from untreated chronic mental health, severe mental health, or substance abuse issues.
We have the latest sort of survey that came out just a few weeks ago that was specifically talking to people who are unsheltered and experiencing homelessness in Orange County. Certainly did point to a significant number of people who are living outside having a mental health struggle. I don't use the word diagnoses because I don't believe that's how it was asked in the survey, but who are struggling with their mental health conditions. And I certainly agree that the chicken or the egg it's a conversation that I find a really important one to have with people when we talk about causes of homelessness. And so thanks for addressing that. Parisa, do you have any kind of data or information about sort of the prevalence of mental health in Orange County across our sort of general population?
Right. So statistically, both of these gentlemen reported, exposure to violence and poverty can lead to mental health struggles. I think Shamsa did a study. Over 70% of women who are unhoused have experienced at least one traumatic event in their lives. And for men, statistically, it was up there as well. So it's not only just the severe diagnosis, which is a large part of our unhoused population, schizophrenia, bipolar, but we forget trauma is very, very prevalent in the unhoused population, especially in our vets, our veterans.
Thank you for bringing up, the sort of the impacts, and I think everybody sort of touched on this in some way, and I know we'll be having deeper conversations in the follow-up in this series, but I do want to just sort of underscore the impact of homelessness on somebody's mental health, as I heard each of you bringing that out, and the realities of that the trauma that comes when you are having to survive on the streets is something that I'm not a professional, so I can't speak as a professional, but from someone who's worked with people experiencing homelessness in a couple of countries over many years, I would attest to the same things that you're saying, that the longer that somebody experiences homelessness, the more trauma that they are likely to encounter, and the more impacts that could have on their mental health and well-being. But as you've all mentioned, mental health is something that affects people who are unhoused and housed. And there can be a lot of stigma talking about mental health. And so I'd love to hear from each of you. What have you found to just be helpful ways to open up this conversation around mental health and engage in better dialogue around this? Dr. Carter, I'll start with you.
Sure. I think fortunately, if you turn the clock back 20 or 30 years, you'll see stigma that is overwhelming. People wouldn't talk publicly about the problem, let alone, talk about their own lived experience. And that's changed a lot. It's a little bit generational. I think that our youth are much more open and also really, actually, for the most part, very supportive of one another. So I think that a lot of progress has been made there. I think as you get up in the generations, there's still quite a bit of, reluctance to address the topic, and certainly to talk about, the individual's own lived experience. So I think, I don't know that I have an antidote for you, but I do think it's important to have conversations like this. I think it's helpful when people normalize the vicissitudes of life, and that can be associated with mental health problems, and that they don't last forever. Recovery is the norm for many, and so that message just needs to get out there. I think 988 is a great thing. I think public relations campaigns actually are helpful. They tend to open things up, and then I think conversations like this are very important.
It is very encouraging. I agree around the shift and different generations having such a different approach and openness to talking about this. I've certainly seen that too. Parisa, how about you? What advice or insight might you have to help continue to break any stigmas that might be attached to this?
Right. I try to frame it and approach it. I tell people asking for help is a skill. So once they embrace that it's a skill, and I want them to work that muscle, that there's no shame in asking for help. In order to be a congruent therapist, right, I should go to therapy. I go to therapy. I've been to therapy. And it helps me live a congruent life, right? The dentist can't pull his own teeth out. He needs to go seek a professional and get that care. It's maintenance. And I tell people, don't wait until you're in crisis mode to get there. Take preventative measures. And it's like Dr. Carter said, it's a forever journey, recovery, and it's daily maintenance.
I would absolutely. I have a therapist. I say therapy has saved my life on multiple occasions, and I use it now to help me exactly that preventative, to help keep me on the path that I want to be on. Absolutely. Kevin, how about you?
I kind of see this as a two-pronged conversation with families or individuals. If you have a family with that's struggling to understand, or there's a stigma within the family, I always used to make the suggestion just to learn, whether it's YouTube, books, online, engage in family to family at NAMI, just learn about that experience, try to understand what might be happening for that person, which will create that empathy, right? So with empathy, we see that stigma reduced within a family or within a particular community. At the same time, you have some cultural challenges with some communities that no matter how much you tell them that it's okay not to be okay, they won't. Right. There's always going to be a very cultural ingrained stigma towards these conversations. So then I think we as a community need to look at ways to say, we don't need to push, but here's care if you need it, and an easy way to access it. Right. That's like Dr. Carter said, 988, or reducing barriers to, with employers to say you don't need permission to call EAP, or, just like how do you present to a community that has a very ingrained stigma about mental health to say, but look, like we understand, but here's care if you need it, and here's the path to accept it. And over time, you'll see that change. Also, just looking at ways culturally to connect, right? Where physical activity might be one way a certain culture or community wants to connect. So how do we then address cultural competent programs that are specific and have open access? So that's my kind of thoughts on that, like a two-pronged, right? Engage in a learning process to create that empathy. At the same time, how do we have open access to care for those that are really have a challenge asking for help?
Kevin, you dropped in a little acronym there that I want to come back to make sure that we spell it out. EAP, share a little bit more about that.
So it was employer assistance programs, right? So a lot of times, so from my law enforcement world, right, we are, from my past life, we are a community that does not want to ask for help, does not need help, and showing that any kind of vulnerability that you might need help is considered weak, right? So when we install peer support programs in law enforcement agencies or fire agencies, one of the main things that we take a look at is not having to ask permission to engage in that from a supervisor and or the employer, right? So giving easy access to those first responders to make that call on their own confidentially. And you'll see that that is a game changer when you do have an agency that says, oh no, you need to ask a supervisor before you can call EAP or call whatever mental health program they are contracted with. And then once you eliminate that barrier, you see those numbers dramatically increase with guys accessing care because there's a path to it. So if you're in a position on this call that you're a boss or a vice president or a CEO of a company that's trying to help their employees, and you have any kind of barrier where they need to ask for permission to engage in those services, I would highly suggest removing those barriers and allowing people just to make the phone calls themselves confidentially.
Thank you. Thanks for digging in there. I know at our organization, we have an employee assistance program. And so when you said that, it's like, oh yes, we need to highlight that and see if perhaps other people, are aware that their organization has one. Perhaps it's a question to take back to see if you do and what that looks like. And as Kevin said, if you're a person in a position of influence in your company, see, what can be done to remove any potential barriers around access to that and make that really easy. So we're in the home stretch of our conversation today. But I would just love to ask each of you, before I kind of move into wrapping anything up, you have a live audience here who are interested and engaged and showed up today to learn. Is there anything that you didn't get to dig into that you would like to? And so I will just sort of pick on somebody. Parisa, I'm going to come to you first. I apologize for picking on you with this, but is there anything you want to make sure people who are watching hear from you?
Change the narrative, advocate for yourself, view asking for help as a sense of empowerment, and normalize mental health treatment. Advocate for yourself. It's definitely an empowering thing. So that's what I would share with everyone.
Yeah. Dr. Carter.
Well, a couple of things. I think one thing that probably is good to acknowledge is that we have an incredible shortage of people who are trained to provide mental health services. And so one of the things that we do at the university is we train the next generation of mental health physicians, psychiatrists, and also on the Irvine campus, clinical psychologists. But there are many different kinds of mental health workers. And I think recruiting those individuals, training them and retaining them and giving them a career pathway will help to address the endless shortage that I'm sure we're all aware of, where we struggle to just staff the services and maintain them at a level that really will meet the need in the community. So that's one thing I wanted to mention. And then I think the other is, we've often focused on the crisis dimension because so many people are in crisis, and it's important to be available and to intervene and support them out of crisis and into recovery. But I think we can also think about prevention, early identification, and one of the things that we're doing in the Department of Psychiatry at UCI, the School of Medicine, is building a early intervention program for young people with serious mental illness, where we provide them with care at a point where it's possible to actually reduce some of the negative consequences of having serious mental illness, including homelessness, as well as some of the other negative consequences, school failure and unemployment and incarceration and or suicide even. So there are sort of more preventive approaches for mental health problems. And I think it's good to be mindful of those, because the long-term impact might start to reverse this trend we have by providing people with tools and care early enough that you're able to sort of break the cycle for them.
Thank you, Dr. Carter. Kevin, how about you?
I would just add that I would just like people to learn, right? Take the time and effort to get some books, go to NAMI, get it online, find resources to learn. Because I think if we all just learn a little bit about what people are suffering with and what people are dealing with, it will create a little more empathy. And I think that's kind of the key to really opening up this conversation, that if you could see and walk in other people's shoes, or at least want to learn that, we would approach those on the streets differently. We would approach those suffering in our communities differently if we had a little more empathy and understanding of what that person's experiencing and what their story is and where they come from. So just learn, take the time to do that.
First, I saw you unmute, so I want to come to you. So did you have something you wanted to add in there?
Oh, no, I couldn't agree more. It's just nodding my head.
Perfect. So on that, is there a book that you would recommend, Kevin, to people who are watching? And I'll come to all of you for this. So if you have either a book or a podcast or a website or somewhere that you think is just a great place to learn, where would you recommend people start? And Kevin, I'm going to come right back to you.
Well, I'll give the official answer. The official answer is if you really want to learn, would be really to engage in NAMI and really dig into some of the free programs. And that would be kind of my official answer. But my unofficial answer would really be, there's so many, right? I mean, there's, if you go to Barnes and Noble, does Barnes and Noble still exist? Right. So you can go to a bookstore if you went to the psychology section and just started looking for titles that looked attractive to you or interesting to you. And read, podcasts. If you're not a reader, there's so many. If you search on these topics that are well done by well-known out there, so there's such a vast knowledge of books, but there's a couple of kind of more prevalent ones out right now. If you went to those bookstores, you would see them. I do have some favorites. You can put my email in the chat there if anybody wants to email me, then doing my book review right now. But but I think if you really have a family member that's suffering or a friend that's suffering, and you really want to engage in a process of learning, maybe start with NAMI.
Thank you. Parisa, do you have any books or podcasts or top tips?
Recently, so a lot of the women specifically unhoused that I've been working with have reported, intimate partner violence, suffering narcissistic abuse. So I actually just recommended a book called Boomerang Love. It's a very easy read, but it's really been helping empower these women to recover from the narcissistic abuse.
So thank you for that one. And how about you, Dr. Carter?
Well, I'm a big fan of NAMI as well. I think that's a really remarkable organization that's had a transformative impact in the United States. And as far as books go, I'm very fond of a book by Ellen Sachs. She's a law professor at USC who also has schizophrenia. You know, that's a primary interest of mine. And it's a wonderful, her story of her journey, which is obviously a journey of recovery and sort of overcoming stigma and people's expectations about what someone with that illness can achieve. The book is called, I think, The Center Cannot Hold. So it's a very easy read.
Wonderful, thank you. And I'll throw in two books I found to be incredibly helpful in my own journey as well. The Body Keeps Score. It's a dense read for me, a non-professional, but I made it through and found it to be incredibly useful. And then similar lines, but a much easier read, What Happened to You by Oprah Winfrey. And I forget the name of the co-author of that book, but to add to some of the book recommendations, thank you so much to each of you for joining us today for such an important discussion. And I really hope that for everybody who joined in, I know that I took things away from this that are really helpful to me, and I really appreciate all of your insights that you brought to us today. A little poll has popped up on the screen, so we would love feedback from our attendees. We always use that feedback to help shape future conversations. And as I mentioned earlier, this is part one of a 3-part series, so we will be back for the second part, where we're going to be learning more about the experiences of people surviving homelessness and addressing mental health concerns. And then the third part in this series is going to be looking at how we can improve services for our community when it comes to mental health services in particular. We have the information about some local resources for addressing mental health crises that are up here on the screen. So 988 we talked about earlier. 211 can help access to any other kind of social service in the community. There's the info up there for Be Well and the info up there for the Mental Health Association of Orange County. As we continue with the broader Hunger and Homelessness Awareness Week conversations and opportunities, we've got 2 coming up next week that are in person. So just wanted to invite everybody to come have dinner with myself and the team on Monday night. We will be in Mission Viejo. There'll be a light dinner at 5:30, and then our program will kick in at 6. And then on Tuesday, we will be in Orange. And again, a light dinner at 5:30, and the program will start at 6. Really excited to be able to meet people in person, have the roundtable discussions as we take a further look into causes of homelessness and accessing the homelessness system of care. And there's some similar struggles around access in that system as there are with the mental health system. So thank you again to each of you for taking your time to join us today. Thank you to everybody who tuned in and helped be a part of this conversation. So I wish you all a wonderful rest of your day.